Good morning, Diana.
Good morning, Kim. How are you?
I'm doing well. How are you?
I'm nervous.
We are live as people are joining, just so you are aware. But hear us and see us now.
Oh, good, everyone. I've only done one panel before, so be easy on me.
You'll be great, I know.
How do you like this cold weather?
Me?
Yes, it's horrible.
It's cold.
Mhm.
Allie, would you like for me to go ahead? Looks like it is 8 o'clock.
It's 8 o'clock. We've got a good group ready, so let's make it happen.
Fantastic. Good morning, everybody. I am thrilled to be here with you and welcome you to Public Health Day in the Capitol. Let me start this slideshow really quickly for you. So I'm just going to open us up with a little bit about CPHA and a general welcome to all of us that are here today to advocate for public health. Really briefly, Colorado's mission and vision, Colorado Public Health Association's mission and vision is to create the healthiest Colorado for everyone. And our mission is to educate, develop, and galvanize the public health community. We are doing all of that today here at Public Health Day at the Capitol. So I'm really excited to wrap all of our mission into one event. We do have a strategic plan that was developed in 2019. What I really want to focus your attention on here is our three goals in the middle. For CPHA, we start with aligning our capacity and infrastructure, really thinking how can we support the organization. Then we look at strengthening public health practice through education. And lastly, again, why we are here today is to build a public health movement. It's important to CPHA that we can advocate on behalf of the health of our communities and what's needed to achieve optimal health in all of our communities for everyone. We need you as members to join us in this effort. We cannot do this alone. So here is my plea to you. If you are not already a Colorado Public Health Association member, please consider joining us. We need you in order to build a public health movement. We are an affiliate of the American Public Health Association, so I just wanted to share that we do align with APHA's strategic plan as well. So you'll see some commonalities between our strategic plan and theirs, and that we as a nation, as American Public Health Association affiliates around the country are all working to build a public health movement, even outside the walls of Colorado. CPHA is the oldest nonprofit representing public health in Colorado. We were established in 1938. We're a 501c3, and we really work to be inclusive of all public health professionals, whether you are a formal governmental public health individual or you are working in a community-based organization that sees yourself in this mission. As of this morning, we have actually 638 members. So I'm really excited about the power of our membership and what we can do with that. Our core areas of work, as I already mentioned, are professional education, policy and advocacy, again, why we're here today, and professional development. So we are also working on all three of these today. We're educating you about how you can be the best advocate. We are advocating today, and we're providing professional development and networking amongst us all. So we do have, as CPHA, a formal commitment to health equity. We define health equity as the active assurance that everyone is afforded the opportunities essential to attaining their highest level of health. We also, in 2020, made a formal commitment to become an anti-racist organization. We have been on the journey since August to really formally move along that journey to become an anti-racist organization. We have walked through the Equity, Diversity and Inclusion Toolkit from the American Public Health Association. We have engaged Ducks in a Row. We're just starting to kick off with Ducks in a Row to help them support our work. And we're really excited about how this work is going to impact the way that we look at policy and advocacy and all of our programming throughout the state. We are a complicated organization. I guarantee you can find some place to align yourself here. We have a lot going on inside of our board and with the organization. So again, I ask you to get involved with us to help us build the public health movement. And then in the end, I just really want to say thank you for being here today, because with you, we can build a public health movement together. Thank you very much.
And now I'm pleased to introduce Dr. Jonathan Samet from the Colorado School of Public Health, who will introduce himself. And I think he's prepared some special remarks just for our group, and he'll introduce Therese Hunt.
Okay, good morning, everyone, and thank you, Ali and Kim. I do have a few slides. This is my fourth Public Health Day at the Capitol, and I will say that last year and this year were certainly unusual. Sorry, just a minute. Let me just get this up and running. Okay, you should have my slides up now, I hope. So I'm reminded actually of a conversation I used to have with my mother when I lamented that there was no Children's Day. And she would say, every day is Children's Day. Well, right now we're at a moment where every day seems to be Public Health Day because of the pandemic. And as Dean of the Colorado School of Public Health, I find myself no longer needing to explain what public health is. Everyone knows what it is. We are in the news. We are doing critical things during the pandemic, while we continue to do the many missions that public health fulfills. And clearly, at this point, a year in, there are many lessons learned, and we are beginning to now hope that we are coming down to the ending days of the pandemic. So what have we learned? I think some remarkable things have happened. Vaccines. We can design, test, and produce them quickly. A year ago, when people asked me about vaccines, I said, gosh, if we're vaccinating people in 2 or 2.5 years, I will think that we are doing well. And here we are now rolling out the vaccines. We've learned an awful lot about SARS-CoV-2 and COVID-19, doing science at a pace that is unprecedented. We understand that there are new challenges, like this figure on the upper right, which is the penetration of the B.1.1.7 variant in the United Kingdom. And here we are now sitting in Colorado, where the first isolates in the United States of this variant were made, wondering what it means for our state. We understand the transmission of infectious agents far better, and we have new tools, big data, analysis of mobile phone data. Down here on the right, a picture of mobility in the state of Colorado, hours away from home. The more hours at home, of course, would indicate that we are being careful and not mingling. And you can see how early on, when we were locked down in April and May, we spent very little time away from home, and how that has trended up. We've learned how to protect people, to protect ourselves. CDC announcing just yesterday how to better mask to protect ourselves. So science has advanced rapidly. No pun intended. We've learned that politics can trump science. And we've experienced this at levels ranging from local public health in Colorado to nationally to internationally. I don't think that public health has ever been so politicized. Even if you look back at the 1918 flu pandemic, politics entered, but certainly it has played out here in an unprecedented way. Who would ever have thought that masks would become a political symbol, a valuable public health tool, unfortunately lost to many. This picture of our governor meeting then Vice President Michael Pence, I think tells an important story. Our governor carefully masked and the remainder not. There's been unprecedented mistrust in scientific evidence and even dismissal of the pandemic as a hoax. And now a critical tool, vaccination. We need to reach herd immunity if we want to return to life as we would like to live it, now an obstacle. And misinformation about vaccines propagated widely. But here, a challenge for public health. How do we communicate about the needs for vaccines, the safety, and yes, the risks? And never has the public health story been so posed so starkly as economics versus public health. It's not one or the other, but finding the right blend of protecting people and maintaining our economic livelihoods. Incredible lessons to date. And then, of course, an important theme, and I know one that my colleague Cerise Hunt will return to. Pandemics thrive on and drive inequities. Inequities drive incidents. People who are in service industries, for example, those in more crowded housing, unable to protect themselves from exposure, or those who are at risk for poorer outcomes with chronic conditions, quality of medical care, healthcare access. And now we're seeing the same story play out with vaccination. The plot to the right shows who's been the proportion vaccinated in Colorado versus the proportion of each group in the population shown by the square. I think striking in this figure, Hispanic, Latinx, you can see the very small proportion vaccinated compared to the proportion of individuals in this group in our population, about 20%. And here, more white non-Hispanics being vaccinated than that percentage. We know we have work to do on inequities, and an important theme of much of what we're doing in public health in the past and with more urgency now. But the pandemic has brought out how critical this need is. I want to talk a little bit about the modeling work that the School of Public Health with colleagues from elsewhere has been involved in. I think this is one example of a success, a state success, a local success in using modeling and explaining the modeling and making the results available to bridge from science to policy. It's almost a year ago, as the pandemic was unfolding, that we were approached by CDPHE and asked about helping out with epidemic modeling. We quickly put together a team drawn from the Anschutz campus, CU Denver, Boulder, and CSU to develop an epidemic model. Here's the institutions involved. We have been working hard ever since, trying to adapt to the changing landscape of the pandemic in the state and provide information to CDPHE and the governor's office that will help in formulating evidence-based policies. For example, what will be the implications of the B117 variant becoming dominant potentially in Colorado, vaccine scenarios, shutdowns, and more. So we have seen reliance here on science to drive policy. Just a few examples. Our reports are routinely posted. This slide shows the trajectory of the epidemic, which we model each week. We track the prevalence of infection in Colorado. It was as high as 1 in 40, 2.5% of the people actively infected. That figure is down to under 0.5% now. And then different what if scenarios that I won't go through in any detail, but this is looking at different vaccination scenarios at the bottom. We've also put up a website to make data available. We, at the request of local and regional public health agencies, carry out modeling now that goes deeper than the state level to large counties and local public health regions. And these data and many others are now available on this Colorado population data dashboard, which was developed with support from a number of funders. Point to another resource. We've teamed with the Denver Museum of Nature and Science for this virtual conversation series on COVID-19. We had, I think, our 27th episode yesterday on vaccine variants. Among the speakers in this series, we've had Georges Benjamin, of course, who heads up the APHA. Some of the topics that we have done, economic impacts, for example, Latin America, covering Mexico and Guatemala in particular, and trying to understand what happened in 2020. Recent speakers have included Governor Polis and Tom Frieden, former CDC director. So I would direct you to this resource. And finally, and I think something for all of us to think about is, where are we going? This pandemic has imprinted us, and that imprint is deep and will be lasting. In the November issue of the American Journal of Public Health, I published, along with my colleagues, Ross Brownson, the lead author, Tom Burke at Johns Hopkins, and Graham Kolditz, a piece on reimagining public health in the aftermath of a pandemic. There are multiple commentaries on this topic in the issue, and I would refer you there because I think we're all going to have to think about where we go as we transition out of the pandemic. How do we contend with these many lessons learned, and think through the impacts, whether it's the burnout of many who have for a year now have been stressed continually, loss of leaders in local public health and higher through the stresses and contentions of the pandemic. So we have a lot to think about moving forward. Just end by pointing you to some of the resources that are available. I urge you to look at the recordings and the written summaries of the series with the museum. We do post our reports. There's a new website I mentioned, and weekly I've been writing about things that have happened and tried to point readers towards resources that may be valuable. So we have a lot of work to do together, both now, hopefully seeing a winding down of the pandemic, and then work to do for the future. So thank you for the opportunity to speak. It's not quite the same as the hustle and bustle of the Capitol during the legislative session. So with that, let me introduce my colleague, Dr. Cerise Hunt. Cerise is recently appointed as the school's Associate Dean for Diversity, Equity, and Inclusion, a past president of this association and a longtime figure in public health in Colorado. Cerise.
Well, thank you, Dean Salmon. Good morning, everyone. I'm so glad to be here. As I was scrolling through the participants, I'm amongst friends and family, so it's good to be here. I'm sorry I can't see everyone, but I have to go quickly because I've been charged. I have 4 to 5 minutes to talk about my new role as the Associate Dean for Diversity, Equity, and Inclusion. And then I'm going to end, and I've been asked to talk about how can students and professionals be activists in their own organizations. And so I'm going to do both kind of simultaneously together to talk about the school's journey. And so I'm going to go back to talk about my position. The Colorado School of Public Health stands with community partners, organizations such as Colorado Public Health Association, in Colorado and across the nation to condemn racism, injustice, and inequity. We believe racism is a public health crisis and are committed to dismantling structural racism. So thanks to Dean Sammet's leadership, this past July, the Colorado School of Public Health community, and when I say the community, we're a tri-campus community, Colorado State University, University of Northern Colorado, and the CU Anschutz Medical Campus, we all came together, faculty, staff, and students. Okay, so when we talk about activism, students, you have a voice. The reason we've organized, I believe, in my opinion, as a school, is you have really held us and told us, you know what, things have to change. We have to do something. So students, your voice matters. You have influence. We all have influence, but students have really and leadership to kind of say, we need to do things differently. We expect things to change. And so with that being said, we came together as a campus community to create a plan for dismantling structural racism and advancing inclusive excellence. Now, you know, and I'm talking about in July, we know that was what was going on at that time as well, too. This followed the killings of George Floyd, Breonna Taylor, Ahmaud Arbery, Elijah McClain here in our own community, Tony McDade, and others, all at the hands of law enforcement. In addition to the high rates of COVID-19 deaths in our Black and Brown communities. So that commitment has strengthened our urgency and our actions increase. And so with that being said, Colorado School of Public Health, we're doing to work to recognize and confront our internalized racism and implicit biases. So we're doing the work and we're learning to think and act in ways to affirm and support our students, staff, faculty, leadership, alumni, and ultimately the communities we serve. So as a school, we're committed to doing the work as well internally to dismantle these structures. So my role is to lead our efforts, because you have to have someone that's leading the efforts. You can't just roll the dice and think it's going to occur. That's we know these inequities that Dean Salmon has showed on his COVID-19 slide. These structures have been in place for centuries. So you have to have a plan, a strategy, and someone who's leading the effort with other leaders. And my role is to create mechanisms to hold leadership, faculty, staff, and students accountable to our structural racism and inclusive excellence commitments. So accountability is key. And so that is my role. So then the next question was, well, how can students and professionals be activists in their own organization? It made me think about, well, you know, because sometimes we'll say these terms like I'm an activist and I'm activist and I'm, you know, about the power and all this other stuff. But activism consists of efforts to promote, impede, direct, or intervene in social, political, economic, or environmental reform. And this is what's key about it, with the desire to make changes. It's about making sure we're changing for the good. So historically, most activism has focused in on creating changes, you know, within our government, our industries, policies, and practice. So we dismantle these policies to rebuild with an effort of focus on dismantling the structures that have perpetuated the inequity. So dismantle to rebuild through an equity lens. And specifically, I'm going to push us a little bit further because of the injustices that we're seeing. I'm going to push us to look through a race equity lens. because we're seeing some of the same numbers and the same trends, and it all has a racialized tone to it. So there's some steps. We want some steps and strategies. What can you do? Students, professionals, all of us have influence. Choose to support racial justice. Be that voice and advocate for change. And like I said before, we all have a sphere of influence. And are you advocating? All of this is about doing the work. It's all about action. Another point is to educate yourself. Education is an essential part of organizing for change. And it's not only educating, you have to apply your learnings to practice. These tools, strategies, and concepts that we've been talking about these for years and centuries. We haven't applied these tools. I'm not coming here with a new idea, a new concept. It's almost like, duh. The issue is we haven't applied this to our practice. We have to do the work. We also need to take political action. Voting in local and federal elections is essential to reforming policies, practice, and addressing racial inequities. So as we're seeing the laws, what's going on federally, what's going on nationally, we see a slide like Dean Samet demonstrates that we're seeing the vaccine rates and who's not being vaccinated. That should be disheartening, because if there was a slide showing who's dying at higher rates, we have the highest rate of death to COVID-19 to our Latinx community, Hispanic population. So how can we not be ensuring that the vaccines aren't reaching the communities? We need to be holding our policies, our state health department, our local health agencies accountable to the plans, and anything that perpetuates an inequity, we need to be that voice for action and change. We can't be silent and just look at the data. We know the communities, we know the neighborhoods that have been historically marginalized. We know the neighborhoods, we know those geographic locations. It's the same groups that are being disproportionately impacted and are dying, are not faring at rates. So we need to do better at that, and we need to take political action. And then we need to partner with other institutions and communities. To achieve racial equity in the community, local and regional government must be working in partnership with communities and other institutions. So this partnership, Colorado Public Health Association, this whole policy committee, you have a role in this process in pushing through an anti-racist, coming together, convening. There's power in numbers. So I hope as you go about your day-to-day, you need to go through this through a racial equity lens as we're looking at our policies, as we are engaging who's benefiting, who's not benefiting, and asking the question why, and challenging and being a voice for change. If you're not using your voice, if you're not using your influence, if you're not pushing the envelope and making people uncomfortable, then I would challenge to say, are you truly being an activist and about that activism work? So thank you all. I'm glad to be here. I know you all will do what's right. I'm hopeful to see change in Colorado, but it's going to take all of us working together as a community and really looking at this through a racial equity approach.
Thanks, Cerise, for being here and for motivating us. We really need your energy and your vision. And congratulations on the new position.
Thank you.
All right, my name is Allie Howe. I'm the Policy Director for the Colorado Public Health Association. Really thrilled to be here. It's an exciting day for Colorado. Again, thanks to Kim Boyd, CPHA President, Dr. Dean Samet, and Cherise Hunt. I'm going to quickly go over our agenda for the rest of the morning, and then we'll dive into our legislator panel. So we just heard, from Kim, Dr. Samet, and Cerise. Moving on, we'll have a wonderful legislator panel with questions that were provided from Colorado Public Health school students and professionals over the last 2 weeks. And that will feature Representative Chris Kennedy and Representative Yadira Caraveo. We may have some pre-recorded remarks from Senator Rhonda Fields, and this will be facilitated by Diana Protopata from Frontline Public Affairs. So really thrilled for that. Thanks for being here. And following that, you will see links for 2 different sessions. The first session is going to be a personal advocacy session with Healthier Colorado with our friends Kyle and Stewart. And so that's a session you'll want to join if you're looking for things for just personal things that you care about, that you'd like to learn more skills. The other session that you can choose is an organizational advocacy session from our friends from Colorado Center for Law and Policy. And after that, we'll all join back together for one final session with Jennifer Piet from the Network for Public Health Law and Diana again. And they're going to cover both local, so for Colorado COVID-19 relief bills, and federal level, and then what that means for us at local practice for public health. And one thing that I'd like us to all do before we go into our next, our breakout sessions, we'd like to know what you care about. So we've got descriptions on here on how to change your Zoom background when we do go into the regular Zoom meeting following the legislator panel. So if there's an issue that you care about, we'd like you to change your background so we can see that during the next breakout session. And with that, I'm going to give the baton over to our facilitator for this next session, Diana.
Good morning, everyone. I hope you can hear and see me. I am Diana Protopapa. I am the contract lobbyist for the Colorado Public Health Association and a partner in the firm Frontline Public Affairs. We have about 27 clients, all related to health, public health, mental health, social issues as well. I'm really pleased to be here today, and I'm especially pleased to be here with Representative Chris Kennedy and Representative Yadira Caraveo. And hopefully they're on and can see us all too. There you go. Hi. And Representative Kennedy, are you here too?
Yes.
Awesome. All right. Well, thank you both so much for joining us. I was joking with Kim Boyd, the chair of the board, right before we started, that I was nervous because I've only facilitated one other panel, and that was years ago. So I'm just giving you both a heads up. I'm kind of new to facilitating, so bear with me. But I'm very excited to be here with both of you today. I think you're both excellent legislators and really well versed in healthcare and public health. So thank you for joining us. We're going to kick this off. At first, I need to apologize that Senator Rhonda Fields was going to be with us, but she let us know on Monday or Tuesday that she has to be at the Capital Development Committee this morning. She recorded a presentation for us, but it was too long to email, and I am technologically illiterate. So I just asked them to send it to us however they can, and we can put it on the CPHA Facebook page for all of the attendees out there. You can see what Senator Fields has to say as well. But let's kick it off. Why don't we start with Representative Caraveo? The first question I have will be introductions from you both, and then a few questions for you to answer in your introductions. And those include, why did you pursue public office? What have you learned about public health since you've been in office? And give us a few examples of bills you are really excited to carry in health or public health that you think improve the health of all Coloradans. And we can start with Representative Caraveo.
Well, good morning, everyone. Very nice. I thank you so much for inviting me to be part of this panel. My name is Yadira Caraveo, and I represent House District 31, which makes up most of Thornton in Adams County. And the reason that I ran for public office is because I'm a pediatrician, hence the scrubs. Sorry, I didn't dress up this morning because I'm going to clinic right after this. I've always been involved in child advocacy, starting back in medical school. and really thought that those two things, advocacy and my interest in politics and medicine were always going to be separate, and they merged closer together as time went by. And so before I ran in 2008, I was getting increasingly frustrated with all the things that I saw kids struggling with, whether it was just their ability to for their parents to keep a roof over their heads, their access to healthcare, issues with education. And so, I realized that instead of just saying somebody should do something about this, that I was in a position where I could run and hopefully do something about it outside of clinic. And so that was the reason that I decided to run. And I think what I've learned about public health since being in office is more about the profession itself. I learned a lot about the theories and the concepts of public health and epidemiology in medical school. But for the most part, outside of pandemics, all the different areas of medicine are kind of siloed off and we don't interact a whole lot with each other. And so I've learned a lot more about your profession, the struggles and the pressures of the profession, and even just the hierarchy and the way that public health agencies are run and are organized. And so that's been really enlightening. A couple of examples of bills that I've run in the past that have affected health. My very first bill actually was really interesting and quite controversial because it was around comprehensive sex ed education. And so it was a great education on how the Capitol runs, how controversial bills can get, and just kind of that melding of health, medicine and public health and education in that melding that you see really just when you run legislation. Another bill that I was proud to carry a couple of years ago had to do with investments in primary care, which was very important to me as a primary care physician. And so we all know that healthcare is really more sick care. It's not really healthcare. And so what we started to look at was how to invest further in preventative care through primary care practices. So what we did was establish a task force essentially that would look at how much money we're spending in primary care in Colorado and how to make future investments and focus on affordability. And that group has put out a couple of reports with some suggestions on how to further increase investment in primary care.
Representative Caraveo, can you talk for 30 seconds or a minute about your bill coming up on the regulation of marijuana?
Absolutely. So it's a bill that is still in development, but once again, like a lot of my bills, this is based on my experiences in clinic and patients that I've had. So I've had a couple of patients in recent years, one, a young man who has had really, really serious mental health issues as his use of THC has increased. And then even just in the last month, a young lady who was using it so frequently that she developed hyperemesis cannabinoid syndrome and actually lost about 25 pounds, ended up in the hospital with electrolyte abnormalities and really severe abdominal pain from rapid weight loss, and then needed really frequent follow-up in our clinic because of that. And I've been hearing more and more stories from other doctors and most importantly from parents about their experiences with their children in the use of really high potency products. So what we're looking to do with this bill is to look at three different things. One is gathering more data. There actually are a lot more studies than we are led to believe by the industry around this. Just a couple of weeks ago, there was another study talking about the effects on suicide and depression from high potency products. But we want to gather more data. So looking at how to get data from ED visits when people present in psychosis or with mental health issues, how to establish something like the PDMP that tracks prescription medications for THC, because we have these suggested or these rules about how much you're able to purchase a day, but people do this thing called looping where they just go and purchase things at different shops all in one day, and that leads to them being able to funnel this to underage users. And then looking at the potency itself, we don't have a great idea over 15%, which is what the Netherlands has set their level at of what is safe, but the levels have changed drastically since we legalized marijuana. And then we want to make sure that patient-doctor relationship when somebody is recommending THC is a real relationship, because what we're seeing with a lot of doctors is when another doctor is involved in their patient's care, they can't get records from that doctor. There's no information about what exactly they recommended. And so it's a very loose system. So still in development, but those are some of the issues that we want to look at, all with the idea that, we have no idea if this is even safe for adults, but it certainly is not safe at these potencies for young people.
Thank you. Representative Kennedy, your turn.
Well, good morning, Diana. It's always hard to follow Representative Caraveo. It's been really a pleasure getting to know and work with her over the last couple of years, and she's an amazing legislator. We're really lucky to have her and her expertise at the Capitol. All right, so why did I run for office? I started my career as a structural engineer. That's what I went to college for, and that's what I ended up doing in my first few years out of college. And, it's not ever that I was particularly passionate about it, but I was pretty good at math. And so guidance counselors pushed me in that direction over time. But it was kind of during my early 20s that I started kind of feeling that itch for public service. And it was at a time when George Bush was in the White House. I was really passionate about environmental issues, and climate change were kind of at the top of my list. And I started kind of getting involved as a volunteer and doing work and it's kind of started opening up my mind about what my career could be if I were willing to be a little bit more creative about options. And I was lucky that I got to make those kinds of choices. So I ultimately left my engineering company in 2009 after taking some night classes in political science and getting increasingly involved as a volunteer, and started over again as a legislative aide for my predecessor in the State House, Representative Max Tyler. And over the years that followed, I worked on a number of campaigns. I worked down at the Capitol as a staffer for 4 legislative sessions. And when Max was term limited at the end of the 2016 year, I decided to give it a shot and run for office myself, and think that I could try to continue my public service in that way. And one of the things I learned at that time is there are a million ways to serve. Running for office is one of them, but there's so many others that people can choose from depending on kind of what their passion is and their skill set and kind of what fits with them. For me, I've always so admired the people that are doing work on the front lines, whether that be the doctors or the counselors or teachers or whomever that are helping people one-on-one. I've always been a little bit more macro in my focus, in that I am not quite as good at doing the one-on-one stuff, but I do like trying to dig into structural problems and figure out what are the constraints happening at the top of the system that are making it harder for those frontline people to do their jobs. And so it's been a great opportunity for me. I was just reelected for my 3rd term, so I'm entering my 5th year in the legislature, which is incredibly hard to believe because it feels like I just got elected for the first time yesterday. But I've learned a ton over that time. And the question was, what have I learned about public health? I would say everything I know about public health I learned in the last 4 years, because I knew nothing about it prior to being in the legislature, except that just having a couple of conversations and being generally aware that it existed. And so I've come to see how valuable a role that the public health plays in our community, and kind of understanding what we'd be like without it. I have worked on a lot of healthcare issues. So despite the fact that I was initially interested in climate change as kind of a primary focus, the way the legislature works, you kind of have to pick a niche. And at the time that I was sworn in, I came alongside some people who were brilliant on energy issues, including my colleague, Chris Hansen, who has a PhD in energy economics. So I thought to myself, I better find a different lane to swim in. And so I started working on healthcare cost issues first and foremost. And so in my first few years in office, I worked on hospital cost transparency, regulation of freestanding emergency departments. I was one of the original sponsors of the reinsurance program that we put in place to try to bring down premiums on the individual market and increase subsidies for folks who traditionally haven't been able to access subsidies through the Affordable Care Act. So those have been some of the things I've worked on. I also got recruited by my good friend, Representative, now Senator Brittany Pedersen, to serve on the Opioid and Substance Use Disorders Interim Committee. So I served on that committee for 3 consecutive summers and helped put together a package of legislation following each of those years that addressed the whole spectrum of substance use disorders, from prevention, harm reduction, clinical practice, treatment, recovery, and then interactions with the criminal justice system. And over that time, I've learned a tremendous amount. Public health officials have been critical parts of those conversations and have been active participants in the work we've done every summer and in the subsequent legislative sessions. So I'm really proud of what we've been able to do there. I've worked on some tobacco issues. Yadira worked on some of these with me as well. For my part, it was just, I was hearing teachers and principals and parents in my district talk about how many kids were vaping in school. And, it hadn't been something I paid all that much attention to before, but I started learning about how easy it is for kids to access these Juul products and trying to figure out the sources they get them from, whether it's buying them online, buying them from gas stations who aren't doing a very good job checking their IDs, having friends who are 18 that are able to buy them and then give them to their friends. And so I worked with Representative Carrie Tipper on a bill in 2019 to allow local governments to add more requirements for tobacco retailers. And then in the next session, I was kind of playing more of a supporting role on what we ended up doing on a statewide tobacco license and raising the age to purchase tobacco products to 21. And then I've also been part of some of the conversations about the flavor ban products, although Yadira is much more of an expert in that space than I am. So I think that the last thing I'll mention is we've done a lot of work at the Capitol on the social determinants of health as well. And so we've had a lot of affordable housing policies that we've advanced, trying to impact renters' rights, bring down some of the egregious rental application fees. There's a warranty of habitability bill we passed. And, of course, during this most recent crisis, just providing money to folks to try to help them afford housing has been a big thing we've done, or whether it's affording housing or utility bills or anything else like that. And I also ran a transparency bill to make sure that hospitals that are required to in order to maintain their nonprofit status, they have to spend a certain % of their dollars on community benefit. I ran a bill to understand what are they actually spending, because they're supposed to be investing in big stuff, and some of them are doing an okay job and some of them aren't. That report just came out and we're doing some analysis on it. So look forward to discussing some next steps on that soon about how we can get our hospitals to increase their investments in public health, mental health, housing, other social determinants. So I've learned a lot. I think we have a lot of work to continue to do because people are hurting out there, not just during this crisis, but they've been hurting for a long time. And it's an exciting time to be in a position to try to make a difference and try to make people's lives better.
Thank you. Also, Representative Kennedy was one of the sponsors of Senate Bill 215 last summer. In part, that would have increased access to health insurance for undocumented immigrants. And then this year, both Representative Caraveo and Kennedy are sponsoring the Prescription Drug Affordability Board that I am working on with them. And that is going to be so much fun. That bill will rein in the very expensive cost of the most unaffordable medications in the state of Colorado. So we are gearing up for one big fight with the drug companies on that bill.
Very big fight.
Yeah, really big. Okay, let's move forward. So CPHA is focused on systemic racism. It is a public health issue. What is Colorado doing to address the impacts of COVID that we have seen in communities of color due to these systemic issues? Whoever wants to start.
I can start there. I think COVID what am I trying to say here? Made apparent all the issues in the healthcare space that a lot of us knew had been present for a long time. I'm sure everybody attending knew about these, but I think that the general public didn't. And in particular, it uncovered systemic inequities that have led to big differences in health, in the predisposition towards things like diabetes, and how that sets you up for other health issues, including more severe cases of coronavirus in this instance, in addition to the fact that healthcare is not affordable. We've been trying to work on that. And so that has impacts on Brown and Black communities and those of lower socioeconomic status in general. And then the fact that the healthcare space is not representative of our population, right? I know this as a Latina physician who I have patients who come from Aurora up to Thornton to see me because they want somebody who not just speaks Spanish, but understands their culture. And so there is often a lack of doctors who understand the issues of Brown and Black patients, but that they relate to and that they're comfortable seeing. And then there's, the entire issue of immigrants and their access to healthcare. So I think it unraveled something that not everybody was aware of. And so I think that one of the big things right now that Colorado is doing is just waking up to the fact that these are issues. Outside of our communities, people, like I said, did not necessarily realize this. And so that the struggle is going to continue. I will tell you that in the Latino caucus, we have been struggling with the vaccine rollout and how inequitable that has been. The Colorado Sun has a really great article about this, but the numbers are not good. In a lot of white communities, the vaccine numbers can be 10 times that of minority populations. And so I know that the governor's budget is looking at investing more in the Office of Health Equity and taking a broader look at what the issues have been around healthcare and its inequity in years past. But I think that more and more we're going to be focusing on these issues, how to level the playing field in healthcare, along with everything else that we're doing around cost that will make things better overall. But it's been very interesting for me to see, as both a healthcare provider and a minority, that people are just now being like, oh, this is an issue, and maybe we should start talking and doing something about it.
I think one of my observations about what's happened most recently is that when you rely on the existing systems to distribute vaccines, to provide healthcare, the haves benefit and the have-nots don't. And just to provide an example kind of from my own life and my own privilege, my parents are both retired. They have economic means and they're fine. And they were kind of on top of it. They have access to healthcare providers. My mom is 68. And so she, as soon as the vaccines became available for people who were 65, she called about 7 different hospital systems to get onto their waiting list for a vaccine. And then the very first day that they were available for people that were 65, she had to drive up to Longmont to do it, but she found a way to get in a vaccine on the first day. These are not things that everyone can do. And so it is kind of a revelation about what it says about our overall system. And now I get that some of these things are difficult to control. I know that the vaccine distribution through hospitals was done rather than primary care clinics because of the cold storage requirements, but also, they just have resources and capacity to do some of these things. And so it's challenging. And I think that's why it's so important that we be trying to get creative and break outside of these normal things. I really applaud the work of our Latinx caucus, who have pushed the governor and said, you have to do better. You have to do some pop-up clinics in some of these underserved communities. You have to increase funding for outreach efforts. But I think, like I said before, I kind of try to think about these things in the macro. So in addition to the immediate response to these things, what I wonder about is how can we change our systems fundamentally so that we don't end up in this case the next time we have a crisis, because this is not the last crisis Colorado is ever going to face. And one of the things I gravitate to is changing the way we do primary care. Now, Yadira knows a lot more about this than me because she's in that world, but I've gotten into the health insurance space and understanding the way that health insurance models pay for these kinds of things. And even after Obamacare, which was a phenomenal step forward for us in a million ways, we still kind of built on top of a fundamentally broken system, in my not so humble opinion. And so I think I've been wondering if we really put some increased focus on transforming our primary care system, tried to figure out how to get to universal primary care so that every single person in our state, regardless of race, regardless of economic situation, regardless of immigration status, had a medical home that they knew they could go to where they could get medical care and they didn't have to worry about paying for it in the traditional way. Sure, they'd still have out-of-pocket costs for expensive hospital care or pharmaceuticals or things of that nature, but at least you get them the preventive care on the front end. They get plugged into these networks. They would have, the doctor would know how to reach them to get them on a list to receive a vaccine when a moment like this arises. So Yadira and I are actually kind of in a brainstorm phase about how we could take a big step forward on that. We actually met with the Division of Insurance about this yesterday to start talking about how we could start changing the system. And that was a long ramble to answer your question, but I think it added something to the conversation maybe.
Well, that's also good foreshadowing for me to know about that conversation you had with DOI yesterday. So I'm sure that's something we can help and engage with you on. So let's broaden this out a little more. I think Colorado is known as trailblazers in healthcare for a lot of the things we do. And because a lot of the stakeholders in healthcare tend to be collaborative, even when we're fighting. One of my favorite sayings is we stab each other in the front and not in the back. So we tend to let stakeholders know if something's coming. Not like that in every industry, but for some reason it works in healthcare. How is Colorado, overall in public health and healthcare, how is Colorado supporting all communities to thrive, do you think? Maybe talk about some past policies we passed to make this happen, what you're seeing in your own community.
I can start on this one, I suppose. I mean, we're doing some things, but it kind of feels like triage sometimes, that we're just finding places to put Band-Aids on it. And this is to acknowledge one of the things that policymakers are bad at. We're not good at multi-year planning. we are okay at doing the year that's in front of us, but even just take a look at our state budget process. Like the full extent of our multi-year planning is we try to have money in a reserve fund, and even that is extremely limited. So it's kind of difficult to do that at times, because it's always just deal with the most urgent stuff right in front of you. I will say that we've had an increased focus on underserved communities, which is part of this problem. And I have to give, I wish I could take credit for this myself. I've tried to be supportive and an ally in this, but it really has been the fact that we have a more representative legislature than we've ever had before, where I have colleagues who remind me, did you think about equity in this bill? Did you think about your own constituency who are primarily white and middle class, or did you think about the whole state? Did you think about rural Colorado? Did you think about, how this could impact immigrants? And so I think that for those of us who come from a lot of privilege, it's been a great learning experience and a great opportunity to do better. And we've found some good things. Like, we've moved big policies on environmental justice over the last few years to try to address communities that are disproportionately impacted by pollution from nearby coal plants or oil and gas operations. There's work continuing on that with our colleague Representative Dominique Jackson, who's working on some bills this year. Diana mentioned earlier that we passed a pretty significant thing without that much of a fight on, well, this part of it wasn't the fight. There were fights over other parts of it. We were fighting with the insurance industry, but we basically passed a bill to, for the first time in our history, provide subsidies to undocumented families to help them afford health insurance. That was a big deal. It was kind of shocking that that wasn't the biggest part of the fight, honestly. We ended up fighting over a percentage point on the rate of a fee we were assessing on insurance companies instead of that underlying issue. But you know, it's going to take a couple years to get that up and running. But when we do, that's a huge step forward for equity and going after an underserved community. And yet, even as I talk about that, like, that's still just a Band-Aid, right? It's a really big Band-Aid, don't get me wrong, but it's not exactly a systemic change that creates a more equitable future. It's just kind of putting patches on different things.
Yeah, Chris completely foreshadowed what my answer was going to be. I mean, I think that we're trying to take care of all Coloradans. I don't know how good of a job we've done so far, but we're sincerely trying. And I think that part of that, as Chris mentioned, is that we are a much more representative body now. We're getting closer to having the actual percentage of Latinos, for example, that are in the state. There's 13 of us now out of 100, so we need to get to 22, but we're closer. And then just the fact that we are a citizen legislature still, although we could get closer to that in practice, means that there's people who focus on all sorts of different issues. And I think that we also have some great legislators like Chris who think about all sorts of different systems and how and try to start thinking about how they interact with each other. So we do things around reproductive justice. For example, I'm carrying a bill this year that will look at Medicaid funding. So there's the Hyde Amendment that's been present since the 1970s, saying that public funds cannot be used for abortion, except for when people are on Medicaid for cases of rape and incest or a danger to the mother. But that's not equitable across the state, because the way that we have that definition of where those services can be provided in the state basically makes it so only certain hospitals can provide that, and essentially those hospitals are in Denver. So we're trying to change that so that's more equitable. We're doing a lot of things around reproductive care to make that more equitable. Chris mentioned all the work that we do in environmental justice, including some bills that Representative Adrian Benavides from Adams County has run, specifically looking at Suncor, right? I've talked in the past about how fracking is the big thing. Everybody cares about oil and gas now that there's fracking in affluent neighborhoods, but nobody was talking about it back in the 80s when I lived in Commerce City, and it was just brown and black people who were affected by emissions. And so we're looking at that more now. We're looking at healthcare. It's a good step that first step that CDPHE has done in pronouncing racism a public health emergency. But what are we going to do about that, right? Are we going to think about these communities when we look at healthcare? And I think we're doing a better and better job of that. What are we doing around housing? We have done a ton of work around housing in the last few years. And this year, I think are probably going to take the housing industry by surprise, because there are about 12 or 15 bills coming around housing, because we know that that housing has been in emergency status basically for a while. And once again, a lot of people didn't realize it until this pandemic, when suddenly, oh, we're going to be facing an eviction crisis when we were kind of already in an eviction crisis. And so there's so many other areas, taxation. Emily Sirota and Mike Weissman have been looking at how do we make that more equitable. We have tons of loopholes out there for corporations. The tax code is often written by those who can lobby to have their interests represented, and there's a whole sector of the population that nobody lobbies for, right? And so how do we close those loopholes so that we can give benefits to those who really need them, which are our families out there who are struggling to make ends meet every single month. So it often feels, when you're in the middle of it, like Chris said, we're really good at planning year by year, feels like a patchwork, but when you step back a little bit and think of all the work that everybody is doing, I think that we're slowly making things a little bit better, but it takes outside groups who have a much longer view sometimes than we do in that year by year or term by term viewpoint in the legislature, to say, okay, let's take a look at this big picture and talk about things that maybe you're not thinking about.
So you both just foreshadowed my next question, and that's around housing. are there, I mean, and I'm familiar somewhat with there are a lot of housing bills, as Representative Caraveo highlighted, a lot. And my colleague Adeline Hodge is fortunate, or maybe not, to work on many of them. There's just, it's overwhelming. But in those efforts, and I'm not overly familiar with a lot of them, is there anything to address structural racism in housing and affordable housing? And if not, how do you think we can address that? Whoever wants to start.
I don't have a preference, Jerry. You want me to start or do you want to? Okay. You know, I think there are direct and indirect ways to confront structural racism that are in the system. And so I'm not sure we're doing something that says, landlords have to confront their biases, although they're subject to anti-discrimination laws, just like everybody. But I think that a lot of what we're doing is trying to target investments on historically underserved communities, which it's such a hard thing to talk about, because even after tremendous effort and tremendous investment, it's still not even close to enough. And for those of us who represent the suburbs, we're also all too familiar with the NIMBY politics that get in the way of addressing some of these issues. So I will say that we've done a lot of work on renters over the last few years. We've really tried to address some of the more egregious practices that have discriminated against renters, that have overly penalized them, have evicted them without really giving them a chance to pay their bills, have forced them to live in substandard conditions. Some of those things we've worked on. A lot of what we need to do in Colorado is invest in housing supply. And this is a hard part of this conversation, because no one really wants to see a new apartment building in their backyard. I mean, I see this from even, and this isn't necessarily even a traditionally progressive versus conservative thing. I have constituents of all political stripes who express all these frustrations about the new development that's going to be across the street, and just think it's the worst thing in the world. And they always find some reason to say, well, yeah, I support affordable housing, I support equity, but just not here. There's always an excuse. And so I'm endlessly frustrated by the NIMBY politics and how it makes it impossible to do some of the things we need to do. And so I think a lot of the work that needs to be done here really is at the local level. And so, I try to partner with my city council, with my county housing authority, to try to work through these issues. But part of it is we need to find public money to support kind of subsidizing these housing projects, and we need to find the land. I'm actually talking to the Capital Development Committee about what public lands in my neck of the woods might be available that the state might not be using right now, that maybe they could turn over to the local governments for local housing projects. And then trying to get these communities on board, saying, this is not going to ruin your community. This is not going to increase crime. This is a perfect place for affordable housing because it's right next to public transportation where people that may not have a car of their own can get to work. These are the kinds of investments that we make now that actually make our communities safer over time. And yet, it's a hard sell. People don't like it. I think that it's incumbent on us to just keep that drumbeat up, because we have to create the pressure to make those changes.
Yeah, and so I think that kind of hand in hand with what Chris is saying, a lot of times the way to get to address issues of racial equity is to not say that that's what you're doing, because that tends to rile some feathers. And so I think it's no coincidence that the brown and Black legislators have taken a big part in a lot of the housing legislation that has been presented and is being presented. And so I think we find ways of, kind of slowly addressing, much like we talked about earlier, where we do kind of things piecemeal, to addressing a lot of the issues around racial inequity in housing. I mean, just for example, this year there is going to be another bill on evictions that right now Serena Gonzalez Gutierrez and Senator Gonzalez are carrying, both from Denver, that looks at things as simple as when you are evicted and you're asked to present to court, a lot of people cannot leave work to go to court, right? The way that the court schedule is made up is that most of these cases come up in the morning at around 10 a.m. Depending on which county you live in, sometimes if you don't present at exactly 10 a.m., then the decision is made against you and you have been evicted. And some counties say, well, we'll wait until the end of the day, and if they don't present by the end of the day, then we'll make that decision. Well, we're going to change that so that every single county does that and realizes that some people are working at 10 a.m. and they might not get to court until later. And so there's a lot of things that we put into legislation that we know are going to be, that we know come from our communities that have told us this is an issue because of the pressures that they face, either because of their income, their work, their race, their background, and that we kind of address piecemeal with those issues in mind. But I can't think of a bill necessarily that says we're addressing all the racism in housing. We do it kind of more behind the scenes.
Thank you. So one of our attendees, Kristen, asked about regarding healthcare access. I'm trying to scan. I know that Representative Kennedy tried to get more information too. This is regarding to healthcare access. So she mentioned that supportive money comes from the state, but there must be private entities that want to support increased access to healthcare. Can either of you maybe address maybe how those private entities could increase their funding around increased access to healthcare? And we have several foundations in the state that provide a lot of funding towards this. Can either one of you talk about maybe some of those projects around increased access?
You know, I think some of this is a little bit beyond my expertise because a lot of it is happening at the local level, but I think, you know, we have a lot of different ways of going after these things. So some of them, I'm not sure which dollars exactly Kristen was talking about, but, you know, if it was about the reinsurance bill and the dollars we were talking about for undocumented populations, those are going to take the form of insurance subsidies. So it'll still be for people to help choose their own places to go. But I know that we also have a number of primary care clinics that operate that, take people with no insurance at all. And whether those are some of the school-based clinics or some of the local clinics, I know that our federally qualified health centers provide a lot of these services too. So I'm happy to dig a little bit deeper on that, but maybe I'll let Yadira see if she can pick up where I left off.
No, those are great points. FQHCs do great work. And then I think just in terms of outside funding or outside involvement in health issues overall, like Diana said, there's tons of different groups and agencies that provide a lot of kind of background support in terms of looking at healthcare. There's the Colorado Health Institute, the Health Foundation, Healthier Colorado, who all do really incredible work, especially in terms of research, to say, okay, you've had a lot of communities come forward and say this is an issue, but legislators like numbers and proof behind things, and that's what they provide.
Maybe I'll just mention one more thing on this. This applies directly to the FQHCs and possibly some of these other clinics. We don't reimburse providers enough on Medicaid. Medicaid is, this is something where every dollar we invest in the state draws down federal matching dollars, and yet the state budget is so constrained that most of the time our reimbursements on Medicaid are below cost. So most providers lose money on Medicaid patients, and that's a real problem because I think this problem has improved to some extent over the last few years with Medicaid expansion and with some of the provider rate increases we've been able to provide, but it's still a big problem. And so what I would just say, because you can't go through a conversation with the Colorado legislator without a mention of Tabor, we have to fix our broken tax code. We have to have a more progressive income tax system. We have to bring in more state revenue so that we can adequately invest in Medicaid reimbursements, K-12, higher education, housing, mental health, everything. The wealthiest Coloradans need to pay more of their fair share of taxes, or else we're never going to be able to adequately fund any of our programs in the state.
So that was funny because I was going to ask you to touch on Tabor since you were talking about that, because that is such a big issue. And those of us in the Capitol stared in the face every day. But when you go out and talk to the public, they really don't know what it is, but they do talk about how there's potholes in the road, or foster kids can't get the services they need, et cetera. So it is so directly linked. And I think that our attendees are very familiar with a TABOR, at least I hope. So let's touch on a moment on the historic pandemic session. We are still in a pandemic, but last year it was at its peak, and we recessed in March and we came back at the end of May. This was not, I didn't send you this question, so I'm sorry if I'm putting you on the spot, but essentially, so I wanted to touch on something Representative Kennedy said about Senate Bill 215 and how we were able to, you know, put increased access for undocumented immigrants for healthcare, and with the increased subsidies. And I really believe one of those reasons was because of the tragic murder of George Flinch. No, I'm sorry. I told George Floyd.
Floyd, yeah.
I don't know where Flinch came from. So George Floyd. And what was really, I really think, I mean, that really highlighted the session in so many ways with the police accountability bill, but also on that, you know, increasing subsidies for undocumented immigrants. I don't think people wanted to highlight that because of everything that was going around with systemic racism and racism in general. Pointing that out, a legislator pointing that out, I think didn't want to face that and take that on. I mean, that was one of my things. That was just something I have in my head. But can you talk a little bit about maybe the police accountability bill or any other bills that got through in such a efficient way? Although the police accountability bill wasn't, I don't think anybody working on it would say it was efficient, but it really got through, and it was substantive. So can either of you speak about some of those eliminating systemic racism bills, or any other bills that addressed racism in that historic session last summer, or helping to eliminate? We know it's not gone.
You're absolutely right, Diana. I think, like I said earlier, we don't necessarily trumpet things sometimes when we know that we're looking at eliminating something that has been racist in the past, or that really looks at race in one way or another. And so, I mean, even in the police accountability bill, there was little, not as much overt discussion about that as one would think for a bill that really was focused on that. But I can tell you that we all knew that it was a really big deal. I have never seen as many legislators standing in front of the board when we were voting, taking pictures of it, because we knew that it was a big deal. We were the first state in the country to pass that. And so a lot of times people, in particular outside of the Brown and Black caucuses, shy away from that discussion. And I think maybe sometimes get tired when those of us in the Brown and Black caucuses don't shy away from that discussion. With regards to 215, I know that there was a big debate as to whether that should be part of the bill or not. And there were people going back and forth because we were in a time of heightened racial tension. And so did we want to take that on? Because we knew, you know, we're both Democrats. We knew that the other side could latch onto that and make a very, very big deal out of it. I know that I had many discussions with some of the lobbyists working on that and told them, leave it in, and we'll see what happens. We can have that discussion. And we were all surprised that there was one question about it. I think one of my favorite moments ever on the floor came around that bill, because finally one person from, I think Castle Rock, came up and said, wait a second. There's this little part of the bill. Does that mean that we're going to be giving you know, benefits to illegal aliens? Because they like to use that word. And Matt Gray literally ran down from the balcony where he was sitting, because we're trying to space ourselves out, and came up to the microphone and said, yes, it does that, and walked away. And then it passed. And so I think we try to shy away from those, from making things overt a lot of times. But I think maybe sometimes we just need to overtly say, yep, this is what we're doing. Are you really going to argue against it?
Yep.
I had forgotten about that moment. Our colleague Matt Gray is one of the funnier members of the legislature, and he has kind of a way of putting a fine point on things. Um, you know, I think that there are different times for different ways of fighting the fights we fight. There are times when the best course of action is kind of move something quickly, try not to draw too much attention to it, and get it through. But I think there's a delicate balance where we don't want to avoid talking about the things that are being done that are really important. So it's strange because time is a finite resource at the Capitol, and that is especially true when we were in our little 3-week pandemic session. And so, a lot of us were feeling intense pressure. You have to make a deal, compromise with someone on this, find a way to turn down the temperature of the opposition, because what we were facing was filibuster, right? And we hear about filibuster in DC, but there are actually finite rules on what filibusters look like in DC. Colorado, you can debate things infinitely if you'd like. There is nothing that would limit the debate. If the party opposing what we were trying to do so chose, they could talk us past midnight every night, and then we'd be forced by the rules to just start over again on the debate the next day. And so these things are really tricky. And when I talk about time being a finite resource, if we let a fight get too crazy, it ends up reducing the amount of time to do other things. And this has happened. In the last several years, we have had some fights that got so explosive that dozens of other pieces of legislation died, and we had to wait until the next year to bring them back. And so that's the balancing act that we find. And yet, one of the things I learned about police accountability this last year is when you're in that political moment where you have an opportunity to do something really big, to kind of break through the traditional opposition to things, to get people to pay attention to something that they've never wanted to pay attention to, they've never wanted to confront, you take that opportunity. And I'm not as good at this as some of my colleagues are, but I really I know Leslie Herod gets lots of shout outs, but I have to give her a shout out here. I remember the call the night of the protest where she was in a crowd and a shot was fired into a crowd of people protesting in support of Black Lives Matter. This was a white person that fired into a crowd that had lots of people of a variety of races who were protesting the death of George Floyd. And I remember being on this call. Our whole caucus got on a call at 9 o'clock that night. And I remember Leslie saying, I want a bill. We have to fix this. I don't know exactly what it looks like yet. This just happened today, but I'm not going to do anything except work on this until the end of this session. And she muscled people together, forced people to pay attention to things. There were a ton of people that contributed to the success of that thing, but it wouldn't have happened without that moment of saying, we cannot let this opportunity pass us by. We can make life better for people in this moment because people are paying attention right now. And we have those in a variety of ways at a variety of times, but that was, it was a really big moment. And, I voted yes, but otherwise I was mostly just a spectator as part of that process. But I was so proud of my colleagues who did the heavy lifting to make that moment happen. And I was proud I just got to be part of it.
Yeah, I didn't know that that's how the bill originated. That's interesting and gave me chills, actually. So we've got a few more questions. And these are ones I've prepared. I've told you I'm going to ask, so I don't think we'll have any more unless they're coming from the attendees. In your individual communities, how do you learn about the social and economic barriers that your community is facing?
That is, I think it's in the way that as a legislature, we learn about everything. I mean, we all come from our bubbles or silos, whatever you want to call them. And we come with our ideas of what we're going to do in legislation and how we're going to vote on legislation. And then we have Colorado come and talk to us. And so the process that is set up for every single bill, every single thing that you hear about it exists for a reason, because it's worked, because it brings, it's worked to some extent, it's not perfect, but because it brings different perspectives to us. And so, you know, to kind of address one question that was, I think in the chat or something earlier is, how should we become involved is you have to talk to us. That's the only way that we learn about other perspectives. Otherwise we come in and we pass what we think is right, and we take the votes that we think are right, and then we go about that course. And so all of the groups that exist in Colorado exist for a reason. They come and they lobby and they advocate and they testify and they email and they call about their perspectives so that we are sure not to forget their perspectives.
Organize, organize, organize. It is my answer to this question. There are lots of ways to reach us and to talk to us about issues, but the volume of communication we have kind of makes it hard to pay attention to everything that we get. And we try, right? And and sometimes we do a good job, but we don't always. And so I think that when it comes to public health officials specifically, I mean, to the extent that you guys are working to come up with a set of priorities and working through your lobbyists to say, these are the priorities for this year, this is what we want to work on, that is a very effective way to do work. And we are responsive to that because, I've known Diana for many years. When she calls me, I usually answer if I'm not in a meeting, and she can say, this is what we're working on. And we've got a bunch of people who are ready to come testify on a bill. I'm like, great, you've done the preparation work. Now I can do my small part, because, the legislators we're rarely the experts on anything. We're kind of oh God, what's the term I've always used for this? I'm making it sound like it's really profound, and it's really not. We're like project managers. We're kind of in the middle of everything. We kind of find the experts, we find our constituents, we kind of navigate the combination of policy and politics, but we lean on you guys. So when you provide information for us, especially when it's done in an organized way, and you can kind of help us prioritize and decide what's going to be the most urgent thing to grapple with, that's a really effective way to go. To the first part of the question about how do we get information generally, some of it arises organically and some of it we seek out. It's actually a really small fraction of our constituents who are engaged. They're the squeakiest wheels, frequently the most ideological. I mean, I've received, like, the topic I've received the most emails about so far in 2021 are people telling me that I've got to do something about Joe Biden's march to put trans people in their kids' bathrooms. It's pretty disturbing, actually. And so we've been responding to them, letting them know, actually, we think that progress on trans rights is incredibly important. In fact, we have a trans colleague who is an amazing human being, and we're so proud to serve with her. And you guys need to just get over your bigotry. So, that's hard, because that's the kind of information that we receive probably most frequently, is those kinds of ideological opinions. So we kind of try to do the rounds through the local organizations. We build relationships with our local public health agencies, our local boards of health, our county commissioners, our city councils, our school boards, and try to reach out to the people that are kind of the experts that are hearing it from the grassroots and that can be kind of intermediaries for us. But all that said, all that talk about organizing, I don't want that to stop you guys from emailing us, because if you can increase our email volume to compete with that ideological stuff, that helps us too, because then we can say, what I'm getting all these emails about is this, or you posted on our Facebook feed. I mean, contribute to this is actually, I should have said this at the beginning. Post stuff on our Facebook pages. There's way too many weirdos posting weird stuff on our Facebook pages. If we have people like you guys posting things, commenting like, I want you to be working on vaccine access, I want you to be working on teen tobacco use, that's really helpful, because it's not only that we see it, but our crazy constituents see it too. They see that that's what we're actually working on. So comment on our Facebook pages, tweet at us and stuff.
That's a great point, Chris, because the people that are the most ideological are the only ones that post on there, and the people that are meanest are the ones that post on there. Somebody asked about like how best to communicate. That is a great way. Something that sorry, my cat is going after something. Something that I always tell doctors, and I think probably applies to you all as well, is give us stories. We are surrounded by data, and I think that in medicine and in public health, I'm sure there's we want to give data, right? We want to give percentages. We want to give this objective information that for some of us, like Chris and I think we love data because of our backgrounds. But that only got so far with especially some of our colleagues. And so hearing about like, this is what I'm seeing out in the community, that only you can tell us that story. Nobody else can tell us that story if they're not in your profession. Whether it's in an email or a call or a Facebook post, that really, or in testimony, that really makes a difference because it makes the issue real.
Okay, so I'm going to be a panelist for a minute. So first, one of the things that I think are so remarkable about you two, truly, is that you find ideas of your own. But there are many legislators that get their ideas from lobbyists, right? So we represent an entity, I'm fortunate to represent a lot of great groups promoting social justice and increasing access to mental health, public health, healthcare, and all of that. So I'm fortunate to consider what I consider representing the good guys, but we will bring issues to a lot of lobbyists or legislators, but you two really do come up with your own ideas. And I think that's remarkable. I was going to save this question for last, but I have to ask it now because we're getting bombarded on our questions. Tell us how public health professionals and students can help you in your efforts, and expand a little on the best way to communicate with all legislators and what's the most effective way to communicate so that it gets to you. You want to start, Representative Caraveo?
Sure, and I think we were touching on this. It's in email, definitely can be effective, but we get a lot of it. And honestly, our aides look at it first. And so sometimes it doesn't make it all the way to us. Phone calls are pretty rare. And once again, our aides kind of handle that. I think, like Chris said, something where it's not just us that you're getting to, it's a lot of people that you're getting to is Facebook and Twitter. But for those of you who are able to take even more time than those two things, by, when we're, so usually off session, we have time to be able to actually meet with people and get to know people better. Is establishing yourself as somebody that we can go to when we need that information is really, really important. So I've met all sorts of amazing people through this job that I can be like, teachers, for example, like, I don't know a whole lot about education. Can I call you and kind of run this past you? Having coffee with us and establishing a relationship with us is the most effective if you can get to that. And then especially for students, reach out and ask if you can work in our offices. I have residents from the pediatric residency program at Children's Hospital that do fellowships with us. Most legislators are happy for any extra help that they can get in their offices. We have, to point out something, we have a staff of 1, and they're only full-time during the legislature. And so that's why organizations become so incredibly important, like Chris said, in our legislating, because they can do a lot of the footwork that we can't with a staff of 1. And so any relationship that you can form with a legislator to put it frankly, is not just, hey, I'm asking for something from you, but I can also provide something, is really the most effective if you have time for that. But any means of communication where, once again, you make that pitch that is personal is important.
Sorry for the pause. I was typing an answer in the chat as you were talking there. I don't have a lot to add to that. I would say that we try to be responsive to everything, and we do rely on our staff to kind of help us with these things. What I would say is if you have particular expertise that you want to share with us, there's nothing wrong with requesting a meeting to share that expertise. We may not always have a lot of time for chit chat as part of that. Sometimes I just schedule 15-minute meetings because I get so many requests that I can just do those meetings. But then if we kind of start getting into something that requires more depth, I'll typically allow for follow-up. I would also say that if you're part of a group like this and you want to band together, we don't need to meet with everyone individually, but you guys could organize a group meeting to share your expertise with us. But there are lots of other ways. The emails, we try to be responsive. I think when we get a lot of what we call AstroTurf emails, which are kind of form letters that don't have a lot of real substance in them. That's not as useful as the direct personal experience. We also don't have time to read a lot of really long stuff. So sometimes if you have a long story that you need to tell, that's fine. But sometimes just a short and sweet paragraph we'll get through. And if you send us something, my aide, whenever it's a personal email, forwards it on to me and says, hey, there's something you may want to respond to yourself directly. Same with social media. I engage most often personally with comments on my social media, and then come down and testify in front of our committees. I'll speak, I answered this in the chat, but I'll go into this too. There are remote options that are going to be available throughout this session. So we are going to be back at the Capitol live, but a number of legislators are going to be participating remotely based on their own public health concerns. And we have a system that we set up where people can testify remotely. You could submit written testimony or you can sign up. The challenge with either in-person or remote testimony is, you never quite know when the bill's going to come up. There'll be 5 bills on the docket, and sometimes you have to wait several hours for the first bills to get done before you get to the next one. But there are ways for you to do this from your own home where you can just sign on using the WebEx tool, and when you get called on in the queue, you'll have a chance to speak to us.
So you both made me look really good, because whenever I do a training, and as I've done to CPHA many times, I talk about don't send AstroTurf. Phone calls are best. Meet with them for coffee, particularly in the interim when you all have time, and become a resource. One of the things I hear from a lot of our clients when we're providing a training is the fear they feel facing you because you're a public official. And I think it really intimidates them. And so I think everyone listening, you can see that they're just real people like you and I. It's really not fair that Representative Caraveo is a pediatrician, so she really is an expert in a lot of ways regarding to healthcare. But oftentimes, you are the expert, and the legislator is just like, an inch deep and a mile wide on issues. So thank you so much for pointing all those out. So we really have one more question, and I feel like it's a little bit, it's a little duplicative, but I think it's important. What does health equity mean to you personally, and how do you address it or try to address it in the bills that you're running? Because it's a priority. So how do you address it in the bills you're running? And I'll ask the next question after that, if you want to address those first two.
The question was, how do we address health equity in the bills we're running?
And what does it mean to you, health equity?
This is another one of those places where I need to make sure I keep my focus on understanding my own privilege and seeing things from a lens other than my own. I never had to worry about it. I always, my mom always made sure that I was seeing the doctor frequently enough, even when I went off to college. Like, have you scheduled a dentist appointment recently? Have you scheduled a doctor's appointment? When was the last time they checked your cholesterol? So I think some of these things are harder for me to talk about personally. But when it comes to policy and what we do, I think I just try to ask the right questions. I try to make sure I don't get so bogged down in kind of the course I'm already on that there's always that opportunity to step back and say, okay, how is this impacting different communities in Colorado? Could this have an unintended consequence? Am I doing something that only serves people who already, benefit from the status quo, or is this something that's actually advancing the conversation? So I'm not sure it's systematic. I think it's just a matter of trying to keep it present, keeping it at the front of your mind, building relationships, making friends with people who have different life experiences. I mean, that's one of the coolest things in the legislature. I've made friends with people who have such different backgrounds than my own, and I learn new stuff every day.
First, I want to comment on something that you said, Diana, that people find us are intimidated to talk to us. I guess we forget that we're intimidating to people. I think. I mean, some of us. I think some people enjoy that part of it. Speaking of people who from the other side that I never would have met otherwise, Jim Wilson just was termed out last year. Incredible legislator that I never would have met him if we hadn't been in the legislature together, but he had something really important to say about who we are as legislators. And he said, we're mostly normal people. The only thing that distinguishes us from anybody else is that we were crazy enough to run for office and we got one more vote than the other person. And that's it. That's all that distinguishes us. So you'd be surprised at how responsive we are. We're not in Congress. We're not off in DC. We live in our communities all the time. And so reach out and talk to us. You'd be surprised at how responsive we are for the most part. I can't say that for every single legislator. In terms of health equity and what it means to me, I mean, it's my entire life, right? I ran because of the issues that I saw in clinic every day. And so if I were ever to know that the work is done, it would be because I can get through a day in clinic without a single frustration or a single sad story to hear or a single thing that I'm like, oh, somebody should fix that. And in my community, it would be knowing that everybody's taken care of, that there's no heartbreaking stories to hear, that there is no frustrations there. I'm running a farm workers bill that's starting in the Senate, and then I'm running it with Representative McCormick in the House, who is a brand new legislator. And we had a stakeholder meeting the other day with farm workers hearing about their stories, and they're heartbreaking. And so what that gives to me and the reasons that I ran for office give to me is not being afraid of taking on big issues. I think I often get comments in the legislature of another controversial bill. But I'm only there for 8 years at the most. And I think Chris has done this as well with his legislation, where it's like, I'm not afraid to make something really, really big and something that's going to change the system and that's going to ruffle some feathers, but that's fine. That's what we're here for. And so for me, it's going to clinic every day, seeing that frustration and translating it into legislation, seeing my community every day, translating that into legislation, and that's how I try to take it
on. Those are both great comments. And I remember a bill, and I don't know, Representative Caravea, how many years have you been there now? 2, 3, 4?
So this is my third.
Yeah. There was a bill that we passed probably before your time, I think, Representative Caraveo, but maybe Representative Kennedy remembers. And I'm struggling to remember it all, but it would require that so many bills go through a process to see how it impacted communities. Is that ringing a bell? You remember that? Was that in your
my bill? Demographic notes.
Yes.
Yeah, I was on that with Leslie Harrod.
Yeah. Can you talk about that for
Yeah, we've been really bad at using it, and I mean to some extent that's because the first session that it could have been used was last session, and it was COVID, and everything got messed up. But we like Chris is, by the way, incredible at acknowledging what his background is and trying to see past it and to be an equitable legislator. He's an amazing person, an amazing legislator. But I think that we don't always do that as a system, right? And so what Representative Harrod's bill and I did was say every year 5 bills from the minority and 5 bills from the majority, and each in the House and the Senate can be tagged as a bill that a demographic note can be pulled on. So for every single bill that we have, there's a fiscal note that tells us how much this is going to cost the system, essentially. And so what this would be is very similar, but it would tell us how is this bill going to impact different demographics, different races, different socioeconomic status, et cetera. And it has not been used to the extent that it needs to be used. So for any bill that you see out there that you're like, ooh, this would be really interesting to have this information on, email your legislator or a legislator and say, hey, do you remember demographic nodes? Maybe you should pull one on this.
So is that how it works? Any legislator can tag a piece of legislation?
We can tag it, but then leadership has to pick it. But
okay. So
far, it hasn't really been done on any. So I think it's something that we have to remind all legislators to remind leadership that we can do.
I think it's important.
Yeah, that's right. I think that it's been underused so far. It's so new that people don't always think about it, but I think that there are good opportunities there.
Yeah, and it's great I think to remind the entire legislative body that it exists, because I felt like that was 5 years ago and it was only a couple of years ago. That's crazy. One more question here, and then we'll let you go. It looks like legislative sessions are in January primarily. When in the year do legislators start focusing on this more full time?
So we kind of go in these phases. And so the way it usually works is I'm going to start with this most recent election, because that's for a lot of people when the job really begins. But for a lot of us, it's also when we stop focusing on campaigns and start focusing on the legislature again. So typically, most of us are working a lot of the time, if not full time, on legislative work in November and December of every year. The people, I really admire the people like Yadira who have other jobs who are providing primary care to people. But for me, the legislature is my only job. So I start working on legislative issues full-time November, December, and start developing policies, start doing intensive stakeholder work. And then in a normal year, we get into January and the session begins, and the 120 days of the legislative session are kind of a crazy circus in and of itself. And in a normal year, we'll have a little bit of lull in May where people kind of relax and unwind after the session, and then kind of start doing halftime on legislative work over the summer, where we kind of start developing ideas for the next session. This year is a little different because we added this extra month break before we start session. It's actually been great that we've had another month to do research and policy development and stakeholding work. So I actually think we're going to have some really great bills that are pretty well put together come next week, which is not normally the case. Normally, the bills are about half done by the time they get introduced and put on bill paper.
Yeah, so that's a great question, because I feel like people forget sometimes that we're out there doing, preparing for legislating until the news is like, oh, they're in session, they're back to work. And then I get a lot of emails in January and February saying, hey, I've got a great bill idea for you. And I have to say, it's too late for this year. Great idea. Let's work on it for next year, because technically we're supposed to stay to 5 bills. Most of us don't, because we're given permission to do extras. But you have to ask for permission past those. So most legislators, their 5 bills are in place well before we start. And if you try to add on, even in December, but certainly in January or February, it's not going to happen. We've got our priorities set, and anything else is going to require permission. So start thinking about it. Remind yourself in October that maybe some people are still looking for ideas.
And actually, Representative Caraveo, you're probably carrying closer to 15, because if it doesn't start in your chamber, it's not counted as your bill. So I bet both of you you're carrying upwards of close to 20 bills. So it's a lot. I want to thank you both today. I think this was amazing, and you both contributed so much. And I think everybody just loved the conversation, and we really appreciate you being here. Thank you.
Thank you. My pleasure. Always great to speak to groups like yours. And please reach out to both of us if you have any questions.
Yeah, it's been our pleasure to be here. And Diana, contrary to your disclaimer at the beginning, you are an excellent moderator and you're a great lobbyist, and we really appreciate working with you.
Thank you so much. I love you guys so much. Both of you are just wonderful. I wish all of them could be like you both, even when you disagree with me. Take care. We'll see you next week.
Thanks again. That was thrilling, exciting. Thank you, Diana, for your help. And thanks to all the excellent questions that we received from our attendees. So attendees, you've got some more work to do. I'm going to share my screen again and give you those directions to update your background as we transition to our breakout rooms. So we really would love to get to know you more when we do this next round in the breakout sessions with personal advocacy or organizational advocacy. So here are the steps. So go hunt in this next 15 minutes, stretch your legs a little bit, and then go look for a picture that shows something that you or your organization cares about. Maybe it's reforms in housing, maybe it's tobacco prevention. So find a cool pic, and those are the directions to upload the image and have it as your background. And we'll also share in the chat the links for you so you can pick which session you'd like to attend. So we've got these links up here for you, and then you'll also see them in the chat. And if you have any questions, throw those in the chat too as we transition. There will be someone here, no matter what, if you have questions in this main room. If for some reason you get knocked out of one of the breakout rooms. So we'll have that next session is going to start promptly at 10 o'clock. And then following that session, we'll come back in here to end our session with our great presentation about both state and federal COVID-19 relief bills. So we will see you on the other side. And again, there will always be someone in this main room if you do have questions. And so yeah, go stretch your legs and pick out your background picture, and we'll see you in the breakout rooms. Thanks, everybody.
Yeah, I think the recording is still on.